is Joanne and I'm a survivor. 10 years ago I was diagnosed with stage 4 non-small cell lung cancer and given 6 months to live.
Can you outline your history?
My history, I grew up in New York. They were not too sure. I was diagnosed in California with stage 4 lung cancer in 2001. And I was given 6 months to live. It was a radical concept to digest all at one time. In the years that I've been surviving, I have been allowed to test drugs that are now available to people who are fighting lung cancer. There was nothing when I was diagnosed. I've been kept alive by those drugs, and it's been very important that clinical trials continue and research money is brought forward to keep cancer at bay and eventually cure. I'm hoping in my lifetime of my children and my grandchildren, it will be treatable in all cases. That's what I live for. Really.
How many clinical trials did you participate in?
I was not in a clinical trial. I was given compassionate use. The clinical trial had been completed on ERISA and was waiting for approval by FDA. And since my oncologist was involved in the administering of that clinical trial, AstraZeneca allowed me to go on compassionate use. And I happened to be one of their best receptors. So I was able to take that drug for 4 years. It kept me alive. When that failed, I went to another drug, Tarceva, which was then by Genentech, and they were just approved by FDA when I started it. So we're getting more and more available to people with that are targeted for cancer cells only. So I have my hair, even though it came in curly from the first the chemo treatments that almost killed me. I decided when I was diagnosed, I was on chemo for 6 months. They thought I would have to stay on it for all of my life, and the chemo was killing me. So I told them no, to stop. And I decided that I would try something in a clinical aspect, and that is why the result. I am here 10 years later, still okay. I've had 6 ablations for new cancer that has grown, also new research that has happened because of the money given for cancer research. It's imperative that we get a handle on treating and wiping out this dread disease. Join the Arkansas Cancer Coalition in recognizing November as Lung Cancer Awareness Month. Learn more at arkansascancercoalition.org. What you know can save your life.